Okay, you're gonna notice that I have a couple things in your chat. If you would like to open those up and download them, you can. Um, you don't have to, but we're gonna be talking about it today. So if you have any equine skeletons, any sheets, you can print them off if you like, if that's convenient, because we're gonna go through the skeleton today. Leanne's on it. Ooh, she got a nice one with a black background. I like that. And we're just going to talk about the skeleton today, because it's interesting. It's an interesting part of the system, and it's nice to have a really good understanding of what muscles are attaching to and the effect that they have on the body. Okay? So muscles are cool, but they're nothing without a skeleton, that's for sure. Okay? So it matters where they attach, because if they attach in different parts, in different areas, it would make a different movement. Okay, so you need to kind of have an idea of the structure of the skeleton, and then also kind of the joints. We're not gonna get into joints a bunch because that's a whole different thing. But I want to go over the names of the bones and the different parts of the skeleton. And then we'll just do some fun facts because I love fun facts. Fun facts are fun. I did just finish a 2-day clinic, which was awesome. That was in Graham, Washington. It was a drill team. A drill team had me out. That was so fun. Great group of women. Great group of women. Super cool horses. Really interesting horses. Lots of different stuff. Nothing, no, normally in my clinics, it's like either they all kind of have stuff in the front or they all kind of have stuff in the hind end. These horses are pretty equal. So that was fun. A lot of different personalities. They did a great job. Nice group of ladies. So that was fun. Let's see. Let's talk about the skeleton a little bit. Uh, There's two parts, and this is going to be interactive, so I'm going to be asking questions of you guys too. There's two parts of the skeleton. It's divided into two. Okay? There's the axial, and then there's another one. Does anyone know what the other one is? You can unmute if you like. It's the appendicular. Appendicular. So there's the axial skeleton and the appendicular skeleton. Now, if I say words wrong, if you think I'm saying them wrong, I probably am. It's not my strong suit. Okay. The axial skeleton consists of the skull and the spine. Skull and the spine. Okay. Well, it's funny. It says the axial skeleton consists of all the bones except for the appendages or the limbs. Okay, yeah, so it's including the ribs. The limbs belong to the part of the skeleton referred to as the appendicular skeleton. So the limbs are the appendicular, and then everything else is the axial. Okay, so this is the part of the section where my kind of overall statement is you ain't got much without a skeleton. Okay, they go into a little more detail than I do. It says the bones of the skeleton. Oh, by the way, this is off of my very first school, which is called Equitouch Systems, and that's out of Loveland, Colorado. I don't know if it's still um in action now or not. I think it is. Somebody else took it over. But the bones of the skeletal system have a mechanical function of supporting the horse. They also form a system of levers for movement and give the muscles, tendons, and ligaments a place of attachment as well as something to work against. Okay, so there's that factor also. Certain bones also serve as protection for the brain, which would be the skull, the central nervous system or the spinal cord. Um, and the vital organs. Okay, so the spinal cord is protected by the vertebral column, And the vital organs are protected by the shoulder bones, ribs, and pelvic bones. Okay, same as with humans. The skeleton also forms the framework for the external appearance of an animal. Other functions of the skeletal system include mineral storage and formation of blood. Okay. So axial skeleton, the skull is made up of numerous bones united by cartilage. Later, bone replaces the cartilage as the horse ages. At what age is the bones in the horse's skull considered to be relatively immobile? So at what age is the skull kind of solidified? Hmm. Oh, Jennifer's coming in. Leanne's really close.
6,
Eight.
8. Okay.
Leanne's like up or down, hot or colder. 8 years old. I assume that that could probably be breed dependent also. Okay. We're going over skeletons, you guys, for those of you that just jumped in. Um,
I
there are
remember,
2 sheets that you can download in the chat if you want to of a skeleton, and you can follow along as you like.
I was
Okay.
recalling, we talked about the back, when was the back formed, solid
yeah.
for riding. And for some reason, I know that 5 to 7 range came in when we discussed that. So that was where I got my 7 from.
Thank you.
Yeah.
Interesting,
And
the head may be longer. It just seems odd.
yeah, it's almost like it formed, yeah, because it's just plates really. So the plates kind of solidify. Yeah. Um, let's see. I'm gonna have to mute this because these are all pictures from the clinic. Okay. So by 8 years of age, the bones of the horse's skull are considered to be relatively immobile. Well, okay, so then there's the occipital bone, the atlanto-occipital joint, and the TMJ. Okay, so I wasn't gonna read TMJ stuff, but we've kind of been talking about it, so I am gonna read it. I'm not seeing the download. Can you guys see it says skeleton quiz? It's the first 2 things I posted, and then there's a picture in the thing. Can anyone see that?
The only chat I see is Leanne's 7.
Oh, okay. I wonder if let me try again. I wonder if it didn't want to do it because nobody else was on. I put it on before. Let me try this. Did that show up? Okay, I got one more. Hold on. Thank you. I think one of them is blank, and then the other one has the words on it. Got both those now? Okay, good. Okay. I'm just gonna read the TMJ stuff, and if any of it makes sense to you guys that are dealing with TMJ stuff right now, you can message me later. The mandible is what we refer to as the jaw and is the only freely movable bone in the skull. It articulates with the temporal bone to form the transporomandibular joint, TMJ. This joint allows opening and closing of the jaw as well as some side-to-side movement for chewing. And like humans, the horses can be affected by TMJ joint syndrome or disease. Over time, the abbreviation TMJ, okay, anyways, TMJ syndrome includes pain or other symptoms that affect the jaw, face, and head. It involves the muscles, tendons, and ligaments of the jaw joint as well as the joint itself. TMJ syndrome usually occurs when the soft tissue and the joints do not work well together. Spasm of the chewing muscle, and I was thinking of you, Jenny, actually, with that other horse here too, that we just looked at. Spasm of the chewing muscle is the most common cause of TMJ syndrome. Symptoms can include aching or dull facial pain and headaches, which of course are not immediately discernible to a horse owner. More noticeable symptoms include tenderness around the jaw muscles, particularly just below the joint, and abnormal tenderness around the horse's ears. Pain can be brought on by chewing and yawning and popping and clicking noises. Can sometimes be heard when the mouth is opened or closed. There you go, Carol. Although spasm of the chewing muscle is most common caused by TMJ syndrome, we might wonder what caused the spasm. With humans, we consider the more common causes to be bruxism, tooth grinding, and blunt trauma. Horses do not appear to suffer the same stresses as humans, although they do occasionally grind their teeth. I don't know if I believe they don't suffer the same stress. I mean, they don't suffer the same ones, like they don't worry about rent and stuff like that, but I know they get stressed. However, they do not generally grind their teeth on a habitual basis. I kind of disagree with that too. So we can probably rule out bruxism as a common cause of TMJ syndrome. This does not rule out tooth problems that can cause trouble and pain to the mouth when the horse is chewing or being ridden. Thus, we might want to begin our list of tooth problems. Blunt trauma is also a possibility since horses play hard and a kick or knock to the jaw might tend to send one's facial muscles into spasm. Since humans rule the horse world, we must include tack and human error as a cause of TMJ syndrome. Ill-fitting bits certainly deserve a vote, as do harshly used training devices such as bitting rigs, the chambon, I don't know what that is, martingales, etc. I would say tie downs. A heavy-handed rider who constantly pulls or saws on the reins will also contribute to the problem. Shank bits probably. All can cause pain to the horse's mouth, which can turn and can promote spasm of the muscle and onset of TMJ syndrome. Okay? Did everyone get that? Yeah, it's our fault, probably. Okay. So the next one we're going to talk about is the spinal column. Okay? The spinal column is divided into several regions, and each section is named after the region in which it's located. Thus, the vertebrae are called cervical vertebrae, thoracic vertebrae, lumbar vertebrae. Nobody calls it lumbar vertebrae though, just so you know. Sacral vertebrae, nobody says that either, and coccygeal or caudal vertebrae. Each vertebra can be abbreviated by referring to the letter symbol for each region followed by the number of the vertebrae in the region. For example, the first cervical vertebra is C1. The second thoracic vertebra is called T2. The symbol for the lumbar vertebra is L, 1 through 6. The sacrum is referred to the sac. Nobody says that. Everyone says sacrum. The symbol for the caudal or coccygeal vertebra is CD or CG. Big C, little d, or big C, big little g. Okay. So let's talk a little bit about the cervical vertebrae. How many are there? Mhm. Who else? Yep. 7. So there are 7 cervical vertebrae in a horse. The first is called the unmute.
Atlas.
Yeah, C1. What's the other name?
Um,
One more time.
it's not coming to me.
Mhm. Jennifer?
C1 is the atlas.
Atlas, that's right. Okay, and then the atlas is married to the what? C2.
Axis.
Yep. So just remember atlas axis. Atlas axis. And you can think of it, I don't know why this helps me, but C1 is the atlas. If you want to look on the atlas, You got to find the axis. That's C2. You can't do those in reverse, can you? So C1 is the atlas. You need the map first. And then if you want to find the axis of the map, you can go to C2. Atlas axis. C1, C2. Okay? The atlas joins with the occipital bone by means of the occipital process. Okay, some of this stuff gets a little over the top, so I'm not going to go over that. The joint thus formed is only capable of flexion and extension. Flexion, extension.
That's the atlas.
That's why, yep, the axis. No, the atlas, sorry, atlas. Flexion, extension. That's why it's often called the yes joint. Yes. Atlas. Yes. And it's also called the pole joint, P-O-L-L, pole. So when people say my horse's pole is out, they're talking about C1. Okay? The yes joint. If you ever have a chance to look at the skeleton, like a real skeleton, it's cool. It's real cool. Take your time and take a look at it. Especially the cervical vertebra, and then the pelvis. The pelvis is really interesting.
I have to tell
And how they
you,
all. Hmm?
I don't know the date, but about 4 hours from here, they're doing a clinic for $150. They're dissecting a dead horse.
I'm doing it. Where is it? That's
It's-
awesome.
It's in Riverton. Well, you could come and stay, but I'm not going with you. I don't think I could
Dude,
stomach it.
that is so cool. I
I
want to do
just
that
don't know that
so
I could do
bad.
it. I know I would learn it so much, but I
It's
just don't know that
crazy.
I can do it.
I could do it.
Yes, you could.
Yeah,
I'll send
Jennifer.
you. Go. I'll send.
I was at a dissection almost a year ago, and it was about $600 to attend.
I
So
know that's what
deal.
exactly. It's about that much.
And I learned so much.
I know.
It's so worth it.
So my
awesome.
trainer, Rada, just got back from a dissection and she was almost like, oh my gosh, what do we do to these horses? She felt really bad. Like it almost was like a love-hate because she's a trainer, right? And she's a dressage trainer. So, she's almost like, Aaron, I really don't know if we should be riding them. I was like, I know, but we're going to, we're going to. But then she started talking a lot about, because she really kind of focused on the head and face. And she was like, Aaron, what are we doing? What are we doing with all this stuff? Like when they pull back on a halter, that's awful. She really kind of had a hard time with it. And then, we use rope halters. Those are pretty severe. They have some pretty sensitive structures on their face. So it was hard. It was hard on her. And I'm glad we need to be challenged like that so that we know we can really think about what we're doing. Okay. So, let's see. The second cervical vertebra is called the axis. It is, fun fact, the longest of the vertebrae. Okay. Those two are completely different shaped, those first two. This one is a pivot joint, pivot, and it's called the no joint. It's the no joint. Okay. So what happens when you have a no joint and a yes joint? When you put those two together, you have a oh my gosh joint. I'm a fancy Arabian joint. Woo! That's how they do that one. Okay? So that's why those Arabians get to throw their head around like that. They got those two joints.
Yeah, and Zanzibar does, I can guarantee you.
Oh, I know. Chester thinks he's the king. He just thinks he's like, watch me whip my hair around. Okay. So the yes joint is the first one and the no joint, and it's not no like this, it's no like this. Okay. So no and yes. The no joint. Okay. So the next three cervical vertebrae are quite similar in size. Now, I really like the shape of the cervical vertebrae, but I'm not going to get into it because they have a lot of cool little levers, right? They got their little side levers, and then they have the levers that slide into the joint in front of it that kind of let it go like this. They got a lot of really cool stuff in the neck, in the cervical vertebra, but we could spend a full hour on just that. But we're not going to do that today. We're just going to briefly go over it. Okay. The sixth and seventh cervical vertebrae are wider and shorter than the preceding vertebrae and vertebrae, and their dorsal spinous process are larger, with the dorsal spinous process of the C7 being nearly twice as high as C6. C7 is the only cervical vertebra that has two costal facets. Those are what I'm talking about, the facets. These facets articulate with the first rib on either side. Okay, because this is the one that attaches to the ribs now. Yeah. Okay. So those are bigger. Okay, so now we're moving into the thoracic vertebrae. How many this is a funny one. This one's good for like Jeopardy. How many thoracic vertebrae do a horse normally have? Nope. It varies. Oh, there's a yeah. 18's the normal number. Okay. Although Arabians can sometimes have 17. Mhm. And then some horses have been found to have 19. Okay. So 18's the average, 17's the Arabian, and 19's the freak.
And why is it? Because I've heard that Arabians have one less. Why is that? I mean,
They
that
like to be special.
but it's like for their endurance, right? Somehow it factors in how they do endurance, right?
Oh, I have no clue. No clue. Yep. Okay. And then they go into a lot about the facets of the vertebra.
I
Okay.
think I was thinking on that Arabians, because I've owned them a long time. You know, it's often like I don't start them till after they're 5 because their backs take a long time. And I think it has to do with the spacing between them. And as a result, that takes them longer to get sturdy because there's a lot more movement in their back because there's just more space in there. And it may allow their legs to stretch more too for endurance. I don't know. But I just know from a health standpoint, it probably allows a longer time for that back to get strong.
Mm.
Because
That sucks because I know Chester was started really young.
yeah. And that's
Way
hard.
too young.
Yeah.
To the point where even the people that started him were like, oh, we didn't know he was that young. I was like, great,
Yeah.
great. Okay. Thoracic vertebra have a high dorsal spinous process. Oh yeah, dorsal, right? Like a dorsal fin, dorsal spinous process. So take a look at your sheets if you downloaded those. You see under that scapula, if you took that scapula off, see how those would be the highest? In the shoulder area, the largest of these processes, approximately T3 through T8, form the area we call the withers. Okay, so you can look at it like your hand. This would be the withers. They're really long, those spinal processes. Okay. From T9 onward, this dorsal spinal process of each thoracic vertebra becomes progressively shorter. Okay. All right. Lumbar. How many lumbar are there? Don't look at my sheet. It'll mess you up. Ah, okay. Good, good. Yeah. Almost, almost. It says 6. It says 6. Well, it says there are usually 6. Some Arabians have been found to have only 5. Some of the horses found to have 19 thoracic vertebrae have also been found to have only 5 vertebrae lumbar as well. Here's fun fact. The lumbar vertebrae have the largest transverse processes. These are the transverse. These are the dorsal. Transverse. So they have the largest. Okay. Sacral vertebra. Next, sacral. How many sacral? Mm-hmm. 5 sacral. 5 sacral. Okay. Are fused by 1 year of age and form what is called the sacrum. They fuse by the age of 5. The sacrum articulates with the 6th last lumbar vertebra and the first coccygeal vertebra posteriorly. Okay. It articulates with the, I mean, obviously it would, right? Because it's not going to float around. It is
So I
also
wonder how
joined.
the Ara-
What?
so how does the Arabian tail goes up?
I know. We need to do a study on Arabians. What makes them so different? It is also joined to the pelvis at the wings of the ilium by a large and strong ligaments. Can anyone tell me something that's interesting about the vertebra going from the lumbar to the sacrum? That's a fun fact, but there's something kind of interesting about them if you look at them. What happens at that SI area?
Well, the dorsal vertebrae, the dorsal
Spinous
process
process.
starts
Yeah.
to angle
Yeah.
back. So
Yeah.
there's a bit of a
Gap.
spot.
I call it, they change directions.
It changes direction.
So if you look at the photo, and every photo should show that, the thoracics kind of go, the lumbar kind of go that way, and then the sacrum kind of go that way. So most of the time it's been going this way. I don't know if that's reverse for you guys. And then the sacrum go that way. Okay. I thought that was interesting. Okay.
Aaron, isn't there a little kind of bump there too?
Yeah.
Yeah.
Yep. And we're going to get to that. That's part of the pelvis. Boop. Okay. The coccygeal vertebrae. I don't know of anyone that calls them the caudal. I've only heard them as the coccygeal. That doesn't mean anything. I'm just saying. Make sure you know them both. Are the bones that form the tail. They are generally from 15 to 20 of them. This is where it's fun. So when you start doing the tail work on your horses, you'll go, whoa, this horse has a really long tail. Now, that doesn't necessarily mean that they have the 20 coccygeal, because some horses have longer coccygeal and some have shorter. But this is where you'll notice a difference in tail length. Like Georgia has a very long tail. Like the tail bones, right? I don't know how many coccygeal she has. I think that's actually going to be our homework, is to see if we can count how many. Now they go up into the hind, so you're not going to be able to get them, but you can count, like if you have multiple horses, count from like the base of the tail and see if you can count them. See if you can actually like figure out where they're at. That'd be fun. Okay. So that number varies drastically, and it's not on breed. It does not depend on breed. Okay. All right. The ribs and sternum. Ribs and sternum. The sternum is made up of segments which are called sternebrae. I've never heard that before. Even though this is my book and I've read it multiple times, I've never heard that. The number of true or sternal ribs will correspond with the number of sternebrae. The sternum of the horse generally is made up of how many? These are going to be the true ribs. That's what they're called. How many true ribs are there? Yep. 8. 8. This is funny. There are 8 pairs of true ribs and generally 10 pairs of false ribs, although 9 or 11 pairs are not uncommon. The total number of ribs will depend on the number of thoracic vertebrae present. Each rib is numbered according to its corresponding number of the thoracic vertebra to which it is attached. Thus, the rib attached to T1 is the first rib. That makes sense? The rib attached to T2 is the second rib. Got it. The spaces between the ribs are called, what's the name of the muscle in between the ribs? Yep. Intercostals. Intercostal spaces is what it's called. In between the ribs. And then the muscles in between, in that intercostal space are called intercostal muscles. Okay. Sternal ribs are called the true ribs because they connect directly to the sternum. Ribs posterior to the sternal ribs are called asternal or false ribs since they are not connected directly to the sternum. Normally, the costal cartilage at the lower extremity or most of the false ribs overlap and indirectly connect the false ribs to the sternal true ribs. On occasion, the last 2 pairs of ribs are not indirectly connected to the sternal ribs. In that case, they're called floating ribs. Okay, so you have the true ribs that are connected to the sternum. You have the false ribs that are connected with cartilage to the sternum, so not directly attached. And then you got them 2 floaters out there. Okay, so fun fact, when Molly and I were putting my clinic paperwork together, she would kind of look up some fun facts and stuff like that, which was awesome. There are 8 true ribs and there are 10 short ribs. And I was like, short ribs? I got hungry like right away. Okay, I started slobbering. And I was like, short ribs? Are they actually called short ribs? I don't know because everything has like multiple names. And so I was like, maybe they aren't called short ribs. And so then I go, this would be funny if I'm like wrong, that those aren't short ribs. And so I typed up equine short ribs. Don't do that. Don't do that. But it just brought up a whole bunch of barbecued ribs. And I was like, okay, I was right. Yeah, that's not short ribs. Those aren't short ribs. And so I sent Molly a text message and I go, short ribs, delicious, but not on a horse. And so I was like, they're not called short ribs. And then I kind of gave her the outline. So we laughed and laughed and laughed. So if you ever see Molly, go ahead and bring that story up. Okay. The bony thorax. That sounds like a Dr. Seuss movie or book. The bony thorax is also called what? This is a trick question. What's the bony thorax? Anybody know what that is? You've heard it before. Nobody calls it the bony thorax. They call it something else. It's real popular right now. Everybody wants to talk about it.
The hyoid?
Nope.
I've never heard the bony thorax.
Yeah, nobody uses that. The thoracic cage. Thoracic cage. That's what everybody says. Okay? The bony thorax or the thoracic cage is formed by the spinal column, the ribs, and the sternum. There's your cage. Spine, ribs, sternum. That's your cage. The interior of the bony thorax is called the thoracic cavity. The inside of the thoracic cage is the thoracic cavity. That is where the heart and lungs are located. The strong structure of the bony thorax affords these organs a great deal of protection. Okay? Okay. Appendicular. Appendicular. I'm gonna have to probably go through this pretty quick, but feel free. So here's a skeleton with all the names on it. And then here's the skeleton without names on it. And then I also have, this is a cool book. This was from this is from Northwest School of Animal Massage. They have this type where you go like that. And then you got that thing that can go like that. You take it off and you quiz yourself. Love that. Okay. And then I got this cool one here where this is this book. I'll show it to you. It's not bad. It's not bad. Maggie Raynor. I just don't like the way this one's organized. That's why I always complain about it. But it's cool because you got the number and then the corresponding thing over there. Okay. All right. Let's start at the scapula. I'm going to just read through this and you guys can take whatever notes on your little papers there you want to, okay? The scapula or the shoulder blade is rather flat and triangular. The horse has no collarbone, so the scapula is attached only by muscle and ligament. That's one of a fun fact. No collarbone. The front leg is attached by muscles and ligaments. That's it. Of this giant horse. A crescent-shaped cartilage exists at the upper end of the scapula called the scapular cartilage. That's important. Anybody seen a broken scapula before? A lot of times it's that right there. Okay. The medial side of this cartilage provides attachment for the rhomboid muscle. At the scapula's lower end lies the glenoid cavity. This cavity allows the articulation of the head of the humerus. Okay, the joint thus formed is called the shoulder joint. Whoops, up higher, right there. Shoulder joint. That's a shoulder joint. Let me get my pointer out right there. Shoulder joint. Okay. The scapular spine divides the lateral face of the scapula into two depressions. The narrower depression above the scapular spine is called the supraspinous fascia. So, the supraspinous fascia. Guess what muscle attaches there? The supraspinous muscle. Okay. The wider depression below the scapular spine is called the infraspinous fascia or fossa. Guess what muscle attaches there? Infraspinous. The depression is called the subscapular fossa. A number of muscles that hold the scapula against the body are attached here on the medial face. So on the inside of this giant muscle, or just this giant bone, there is a cavity and muscles attached to that hold the scapula onto the body. Okay. Okay, next one. What muscle is this? We have one too.
Pectoral.
Starts with an H. Yep. Humerus. Humerus. Or arm bone is classified as the long bone and consists of two shafts and two extremities. The proximal, so remember, proximal means close to the body, and distal means further from the body. Proximal is close to the body, distal is further. You'll hear that. Where did I go? The proximal end or articular head joins with the scapula at the
All I
glenoid
have
cavity
towards dinner is lettuce and beets.
and forming the joint. Okay. Okay. This one has a lot of tuberosities on it, which I find really interesting. I would love to do a study on tuberosities. And I have a cool book that talks about that. Let me see here. It's all the areas that you can palpate. Now, we'll do that sometime because it's really cool. All the little areas that the muscle's attached to. Okay. Okay. So that's the humerus. The next one is the radius. Okay, radius. The radius is well developed and enters the elbow joint at its proximal, close to the body, and the carpus at the distal end. Distal, distance. In the horse, the ulna is well developed but is short and fused to the radius. That's the one that sticks out right there. Boop, boop. That's two bones that are fused. This forms the electron process, or the point of the elbow is actually a part of the ulna, which projects beyond the elbow joint. The electron process serves as a lever for the attachment of muscles which extend the elbow. The area from the elbow to the distal end of the radius is often referred to as the forearm. Okay, carpus. Carpus, commonly referred to by the layman as the knee. Just the layman though, not the normal people, just the layman. Okay, actually corresponds to the wrist in the human. There's that one chiropractor that just drives that home all the time, right? He hates it that we call it the knee, and he wants us to call it the wrist. And I'm like, get lost, buddy. It ain't happening. Okay. The carpus is a complex joint which lies between the radius and the cannon bone and contains two rows of carpal bones. How many carpal bones are there? I was actually wrong on this. I mean, I was technically correct, but I was wrong on one of it. How many carpal bones are there? One? No. Oh no, much more. Many more. Nope.
I think there's 9.
Nope.
7 or 9.
You're almost there.
Oh,
Let me find it. I'll put it in the chat. I printed something off for it. Uh-oh, maybe I didn't. Oh, yes, I did. There it is. There you go. Fun fact. 7 or 8. 50% of horses do not have one of the bones, so that would be the 7. Okay. I was wrong because I thought it had 6, 3 on the top, 3 on the bottom, and then one that sticks out the back. Well, I guess technically that would be correct. That'd be 7. I don't know where they're coming up with 8 though. Okay. The carpal bones are bound together by a strong system of ligaments. 50% of horses do not have the first carpal bone. I'd have to look up to where it's at, even at. And then it's interesting, cows only have 6. Dogs have like a different number, so that was kind of interesting. There is little movement other than a slightly gliding allowed by the structure of the carpometacarpal joint. Smaller joints are also formed between adjacent carpal bones. These joints allow a limited amount of movement. However, they are part of the natural shock absorbing system of the leg. Okay. Next one, cannon bone. Cannon bone actually consists of one large metacarpal bone and two smaller metacarpal bones called splint bones. Splints are when those two little bones that are attached get irritated and they get like irritation in there, and then they kind of swell. It's painful. Okay. The fetlock joint, fetlock is a hinge joint with dorsal. I'm not going to get into that. Is the main role as a shock absorption and local motion. Okay. And then we have some proximal seismoids. Those are little tiny round bones that are like pebbles. Those are on the fetlock. And then we have the long pastern bone followed by the short pastern bone. That articulates with the coffin bone, which articulates with the navicular bone. We've all heard of those. Unfortunately, some of us, right? The deep digital flexor tendon passes over the back of the navicular bone and holds it firmly in the coffin joint between the wing and the coffin bone. And then I love this part of this book. It says, the study of the foot and hoof is itself quite lengthy. Such study is outside the scope of this particular program and will be dealt with at length in one of our advanced courses. You can't cover everything. Okay. Next, the pelvic girdle. I don't know it's called that anymore. The pelvis is made up of two equal halves. Each half of the pelvis consists of three flat bones, ilium, ischium, and pubis. These three bones are fused to make up one composite bone. The two halves of the pelvis meet ventrally at a point called the pelvic symphysis and are joined by a layer of fibrocartilage in the young horses. In the adult horses, this cartilage has ossified and been replaced by bone. Thus, there is no noticeable movement at this point. That's actually not true. There is a very, very small amount of movement. I've seen it. It's cool. If you guys follow Three's Hicksman or something like that, she does a lot of cool stuff. There's another lady that does some other cool dissection stuff. Three's Hinsricks, I don't remember. She does a lot of dissections that talks about bones all the time. It's awesome. Okay. The ilium forms the upper portion of the pelvis. The pubis forms the front of the pelvic floor, and the ischium forms the highest most portion. The point at which all three bones meet is called the acetabulum or the hip socket. The acetabulum forms an area for articulation joining with the head of the femur. That's where the leg meets the pelvis. And then it goes into the major trochanter and the third trochanter. I love the trochanters. I find them very interesting. We should do something on that at some point. You can actually palpate the third trochanter pretty well. It's on the femur. Both major trochanters and the third trochanter serve as levers for insertion of the various gluteal muscles. So that's where them gluteal muscles attach, so it's a big deal. Okay. Then you have the patella, which is the kneecap. Did we skip the femur? The femur articulates with the acetabulum at its upper end. So the femur's next, femur. And then you have the kneecap, which is the patella. You know, my husband, my dad actually had a knee replacement, and his follow-up appointment for his doctor was on Halloween. And so I told the doctor, I said, I'm gonna come in a Halloween outfit. And he was like, okay, whatever. You're weird. And so I took a piece of paper and I cut it in like kind of a triangle. And then I put a rubber band around it and I put it over my face and I said, what am I? So it was like this thing in my face. And he was like, I don't know. And then I moved it slightly up and down and I go, what am I? I mean, this is the knee doctor. Come on. And I was like, I'm the kneecap. And he died laughing. He died laughing. I go, this was for you. I didn't do this for anybody else. I did it for you. So funny. Sorry. Weird patella humor. Okay. My dad thought it was awesome, so that's all that matters. Patella. Okay, these exist for the articulation with the tibia at the stifle joint. Tibia. Tibia. What other bone fused to the tibia? They go together, they're married.
Fibula.
Yep. Tibia fibia. Okay. Tibia fibula. The tibia and fibula correspond to the radius and the ulna in the forelimb, right? They were married too. The tibia is the larger bone and extends between the stifle and the hock. Its proximal end bears the tibular tuberosity, which is the attachment for the patellar ligaments, and the lateral and medial condyles. The lateral and medial condyles are separated by a sharp ridge called the tibial spine. The fibula is the smaller of the bones and articulates with the tibia at the outer surface of the lateral condyle. The fibula is similar to the splint bones of the forelimb, and the area of its distal end, distal, far away, is fused to the tibia is called the lateral, oh, I didn't know this. The lateral malleus, Malleolus. 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 I don't know. Ankle bone. Nobody says that. The area in between the tibia and the fibula is referred to as the interosseous space. Nobody says that either. The entire area between the stifle and the hock is referred to as the gaskin. There we go. I was like, I don't know any of these. Oh, gaskin, got it. Gaskin. Okay. The hock is comparable to the human ankle. You know what? I'm going to find that. The hock is comparable to the human ankle. Yeah, there's a lot of other information in there. Hold on. I'm going to find that one. There we go. Hold on. This is always interesting to me. I've seen this before. Here we go. I like this one the most. You can find these anywhere. Okay, share screen. Share. Okay, this one right here. This compares them. I think it's kind of cool. If I click on this, is it going to go away? No. Did I make it bigger? Nope. Oh, here. There we go. See, here's the pelvis, scapula, arm, femur, humerus. See, there's ours are not connected, those two. This one is. Ankle. This is why it's the wrist, right? This is the wrist. We call it the knee. Drives that dude crazy. Okay, middle finger is what the horse foot is foot. And then the other two slide up. Okay, and then there's the ankle there. Isn't that cool? I'll put that in the thing too, if you want it. It's kind of cool to look at. There you go. Okay. The hawk is comparable to the human ankle. There you go. Let's see. Okay, and then there's the metatarsals. The third tarsal occupies the lowest row. Is fused with the first and second tarsal are located at the medial side of the hawk. Okay. And then the rest are phalanges, like fingers. Okay. However, in the hind limb, the cannon is called the metatarsal bone, and the phalanges correspond to the toes rather than the fingers. So that's slightly different in the back, the hind end. Okay. There you go. That's the skeleton. It's pretty cool. So I am for sure going to be doing a muscle anatomy course. It's going to be awesome. I'm going to finish my, I'm going to do my equine business builders course first. That's going to be 4 weeks. And then I'm probably going to start the muscle anatomy course. I just have to figure out how in depth am I going to go. I might start out with the major muscles first and then go a couple layers deeper, but it's a lot. That's a lot. So we'll see. I got to figure that part out. Okay. That's going to be fun though. And that's where this skeleton stuff's going to come in, because when we're talking about the muscles, we're going to talk about where they insert. Muscles insert to either fascial planes or they insert to kind of like sheets, okay, sheets of fascia, or they insert to bones. Okay. So it's pretty cool to find out where those go and what makes them move. Because once you figure out, this is where I have figured out a lot of my range of motion stuff, is once you figure out where those muscles insert and what the movement should be, whenever it's restricted, you can find out exactly where it's at. What's the problem? My horse can't straighten their leg. Well, what muscles flex the leg? So you go the opposite. If your horse can't straighten their leg, what muscles flex the leg? Those are tight. You do the opposite. Okay? If my horse can't bend one direction, what's the opposite side? If it's not a skeletal issue, sometimes it's chiropractic. So that's kind of how I figure stuff out. Okay? Any questions on all that? I'm not a skeleton expert, so I don't know. It's fun though. Okay? So your homework for this week is to see if you can count how many, what are they called? Coccygeal or caudal? Nobody calls them caudal. Coccygeal sounds cooler. Okay? Caudal does not sound cool. So count count how many coccygeal vertebrae your horse has in their tail. And remember, they start up higher, so you're not going to be able to, right? They start up here, so you're not going to be able to count those, but or maybe you can palpate them. See if you can find out where that sacrum has ended. You know what I mean? See if you can. Go from there. Alrighty, tidy? Cool. Carry on. Jenny, you gave me some photos, right, of that horse? Okay. I'll put those up too. So if you guys haven't seen, what's his name? I forgot.
His name is Wally.
Wally, yeah, Wally, WALL-E,
Yeah.
Wally. If you guys didn't see those muscles on his jaw were all, she did some awesome videos. Awesome videos. Changed that horse's life. Okay. So, if you haven't seen those are on the coaching community. If you're not on the coaching community, you need my clinic. You can ask me about it. And she'll put up those videos, those photos of the after work. Those videos are awesome though. Loved it. He was like, "What's happening to me?" It was awesome. All right. Talk to you guys later. Have a great week. Bye.